Hello everyone, welcome to HIM 225. This is a continuation of the lectures covering chapter 22 in your textbook. If you would, turn to page 541. And we're talking about a normal delivery. In the index, we put in delivery and normal, and you will see that it takes us to code 080. Now we have a very limited definition of what qualifies as a full-term uncomplicated delivery. And it tells us here in the tabular that this is a delivery that requires minimal or no assistance. The code that we use, the procedure code that we use with 080 is the procedure code for a manually assisted delivery, and that's it. Any other procedure code other than episiotomy would not be, you would not be using code 080. We can have an episiotomy, but we cannot have an extension of the episiotomy, or we cannot have any tears. If we do, then we're not at this code. There's no fetal manipulation that occurs with this code. There's no rotation version. We can't use any instrumentation, no forceps, no vacuum extraction. So it has to be just a perfectly normal delivery. It has to be a vaginal delivery. It has to be a full-term infant. It has to be a single infant, and the infant has to be live born. Any other diagnosis code from chapter 15 that would be used would mean that you are not using a code. You are not using this particular code. So very limited. Now, many deliveries actually are 080 deliveries. The only outcome of delivery code that we can use with this particular code is Z37.0, which is live born single infant. Look at the example, this second example on page 541. Patient's admitted in labor. She's 40 weeks pregnant, so she's term. An uneventful pregnancy, vaginal delivery, and the patient has an episiotomy. This is 080. She has our outcome of delivery is Z37.0. Then we're also coding for the week's gestation. We are applying the code for the episiotomy from the procedure index, or from the procedures, and then we are also using the code for the manually assisted delivery. So perfectly normal here, and this we have 5 codes for this normal vaginal delivery. In the next example, the patient comes in labor. She's 40 weeks pregnant, uneventful pregnancy, vaginal delivery, an episiotomy, but they use the vacuum extractor due to maternal exhaustion. Now, I want to show you how to find this code, and you need to write this down, put it on a note card. It's kind of unique. If we go to exhaustion and then maternal, we will find this code 075.81. This is the only way that I have found that you can find this maternal exhaustion code. Then we're using the code for the 40 weeks gestation. We're using the single live born outcome of delivery code. Then we are also going to be coding the fact that a vacuum extractor was used. So in the procedure tab, let's put in delivery. And you'll see we have vacuum assisted products of conception. And so we're at table 10D0, and this was via natural or artificial opening, and there's no device, but our qualifier is vacuum. So the code is 10D07Z6. And then Of course, we're also assigning the code for an episiotomy. And when we go to that in the table, it actually fills in that code for us. Now let's look at page 542, the top of page 542. This is a patient who is admitted in labor. She's 40 weeks pregnant. She had an uneventful pregnancy and she delivers a 7-pound live baby boy. She has a first-degree perineal laceration that is repaired. So this is not going to be an 080 because of this first-degree peritoneal laceration. In the index, we're going to go to delivery complicated by laceration perineum first degree 070.0. Going to verify that in the tabular. And you can see that my internet is slow this morning. And so here we verify the code in the tabular. Now, of course, we're using the code for the week's gestation. We're using our outcome of delivery code. We also have a code for the manually assisted delivery. And then we need to code the repair of this perineal laceration. So in the index, we're going to repair and then skin perineum. And it gives us the default code OHQ9XZZ. And I want you to notice that while we're here in the table, there is a CC up at the top for Coding Clinic. When you're coding and you see these in the table, you should take some time to review them so that you can be familiar with what they're covering. And this takes us to a Coding Clinic guidance on coding obstetrical perineal laceration repairs. And you need to review this. If I were you, I would print this out. But this talks about how we code the different degrees of lacerations and the codes for those lacerations. So it describes for you what each of these degrees are. So first degree injury to the outermost layer of the perineum and the vaginal mucosa. Second degree, third degree, fourth degree. I'm not going to read those to you. You can pause this and read those yourself, but I really suggest that you print this out and have it to use as a reference. So that perineal laceration will prevent us from being able to use 080. In the next example, the patient comes into the hospital 40 weeks pregnant. She had a UTI early in her pregnancy, and it was treated appropriately. She doesn't have any issues with it now. She delivers a baby, spontaneous vaginal delivery. This is an example of when we can use 080 because that UTI was treated, it was resolved, it's not impacting her pregnancy or her delivery right now. So because of that, we can use the 080 code. Now let's look at the peripartum and postpartum periods. And if I were you, I would record these and put them on a note cards. So postpartum begins immediately after the delivery, and it continues for 6 weeks following the delivery. The peripartum period is the last month of pregnancy to 5 months postpartum. So just kind of keep that in mind. So let's look at this next example. The patient comes into the hospital for mastitis. She's 2 weeks postpartum, and she's given a course of antibiotics. So in the index, we're going to go to mastitis, and then you'll notice that this says obstetric associated with the purpurium. 091.22, and we can verify that in the index. In the next example, we have a postpartum. The guidelines tell us that a postpartum complication is any complication occurring within the 6-week period. And in this next example, the patient's admitted to the hospital 3 weeks postpartum. She's having pain in her right calf, and she's given a diagnosis of deep vein thrombosis. She's treated with IV heparin. So in the index, we're going to go to thrombosis, and then we're going to go to vein, deep. And I want you need to notice how I'm finding this code. You can go to thrombosis, deep, and vein, but it doesn't take you to the most specific code. So if we go to thrombosis, vein, and deep, we can see that we have the code here for calf, I82.4Z. And when we verify that in the tabular, we're going to choose 1 because that's specific to the right lower, and that's what we have, correct. Okay, so now we need to apply the code related to the fact that this is an obstetrical. And you'll see that it tells us here, when we go to the beginning of this category, we have a code first. And it tells us pregnancy, childbirth, and the puerperium, and it gives us the range of codes. So we know first we have to code the fact that this is happening in that postpartum period. Now in the index, if I go to postpartum, you see it tells me to see puerperal, so I will go to puerperal. And then this is thrombophlebitis. It's deep, and so this sends me to code 087.1, deep phlebothrombosis in the puerperium. So that is our first listed code. And then you can see that it tells us here to use an additional code to identify the deep vein thrombosis. And of course, we have actually already done that. Pregnancy-related complications after the 6th week period. So this guideline tells us that these codes can also be used to describe pregnancy-related complications that arise after the peripartum or postpartum period if the provider documents that the condition is pregnancy-related. So in this example, the patient's admitted to the hospital with postpartum cholecystitis. She delivered 8 weeks prior to this presentation, so 8's more than 6. And because it's documented as a postpartum cholecystitis by the physician, then we are going to code it that way. Now, let's find this code. Now, in the index, if we go to puerperal, we won't find puerperal cholecystitis. What we have to recognize is that this is a gastrointestinal disease. And so this sends us to code 099.63. And you'll notice that this is in category 099, other maternal diseases classified elsewhere, but complicating pregnancy, childbirth, and the puerperium. So we have to choose a code from this category because it is in this postpartum period. And so here we have our code. If we go to the beginning of this category, we have our instructional note here, use additional code to identify this specific condition. And this includes conditions which complicate the pregnancy state or are aggravated by the pregnancy or are a main reason for obstetric care. So then, of course, we want to code the cholecystitis. And we're using the default code for the cholecystitis K81.9. There may be instances where an OB patient delivers before they get to the hospital. And so the guidelines tell us that if the patient delivers outside of the hospital and that she's admitted for routine postpartum care, that we assign code Z39.0. And in the index, we can go to admission, postpartum observation immediately after delivery, and we find this code Z39.0. And you're going to have to see how your facility handles these. Many, many years ago, when I coded, if we had patients that delivered prior to being admitted to the hospital, they delivered in the ambulance on the way to the hospital, but when they got to the hospital, the physician actually delivered the placenta, then that physician would document that he was the one that delivered that baby, and we would code it as a delivery. We did not use this Z code. Now, we also have guidelines for pregnancy-associated cardiomyopathy. In the index to find this code, we go to cardiomyopathy postpartum. And this is unique in that it can be diagnosed in the 3rd trimester of the pregnancy, but it can continue to progress months after delivery. So because of this, it's referred to as peripartum cardiomyopathy. Postpartum myopathy is the same code, as you can see. So, and the code that we use for both postpartum and peripartum is 090.3. It's only used when the cardiomyopathy develops as a result of the pregnancy in a woman who did not previously have this pre-existing heart condition. And in this example, the patient is 2 weeks postpartum. She comes to the office complaining of shortness of breath, swollen ankles, and frequently awakening to urinate. So the physician performs a CT, and his diagnosis is postpartum cardiomyopathy. Now that's going to conclude this lecture for Chapter 22. Your question for this lecture is on page 557. It's exercise 22-4, question number 9. And you'll answer that multiple choice question in the assignment following this lecture. And that will conclude this lecture for Chapter 22.